Between the ages of 17 and 25, the human jaw undergoes one final biological shift. Deep below the gums, a late-arriving set of molars begins to push upward, actively searching for room. For decades, this exact biological window has fueled an entire internet subculture. You've probably seen the videos. People waking up in the recovery chair, saying absurd things to their families, sporting massive ice packs and completely swollen cheeks. Watching those clips, it is easy to assume the extraction process is inherently traumatic. But there is a gap between those chaotic internet compilations and the underlying biological reality of the procedure. Today, the removal of these third molars is a heavily mapped medical routine, though the public's perception remains largely anchored to those viral moments of post-operative recovery. Let's start with the baseline biology. These late arrivals are your third molars. If your jaw happens to be exceptionally large and these teeth grow in perfectly straight, there is no medical reason to intervene. You simply get extra teeth. The catch is human evolution. Over thousands of years, our diet softened and our jaws shrank. For most adults today, the physical real estate at the very back of the mouth simply does not exist to accommodate them. When you look at an animated cross-section of a crowded jaw like this, you can see exactly what happens when that space runs out. The tooth gets trapped below the gum line, a state known as impaction. Often, it ends up growing entirely sideways, colliding directly into the root of the neighboring tooth. This trapped growth pattern sets off a localized chain reaction. The pressure breeds chronic pain, creates deep pockets where bacteria invite infection, and acts like a wedge, creating a slow domino effect that physically forces the rest of your healthy teeth out of alignment. Because this is a mechanical problem of restricted volume, the only effective solution is a precise physical intervention. You have to extract the wedge to save the arch. Historically, extracting a hidden tooth involved surgical estimation. Clinicians had to rely on flat images and physical probing to understand what lay beneath the tissue. Now, specialized clinics completely map the area before any instruments are picked up. The primary diagnostic tool for this is the 3D OPG X-ray, an advanced imaging system that peers through the bone and soft tissue. This diagram demonstrates what clinicians actually see. The 3D scan renders a complete topographical map of your skull, highlighting the hidden tooth and its exact proximity to delicate nerve pathways and sinus cavities. By mapping the trajectory in 3 dimensions, a surgeon can accurately forecast the tooth's collision path. They can clearly see which teeth will eventually cause damage, like the one flashing red here, and which ones can safely be left alone in the green. This level of pre-planning enables a surgical path that avoids unnecessary tissue disruption, resulting in a faster, more controlled operation. Of course, all the diagnostic tech in the world doesn't automatically switch off a patient's nervous system. The anticipation of operative pain is a real psychological hurdle. To bypass that fear response, modern extraction protocols rely on customized sedation. Depending on the patient's anxiety levels, clinicians can administer targeted local anesthetics so the area is numb while you remain awake, or use a deeper sedation where you have zero awareness of the operation happening at all. Because the 3D pre-planning maps out the precise surgical angle beforehand, the actual time spent in the chair drops. Less time operating means less cutting, which helps reduce trauma to the surrounding gum tissue. By pairing pinpoint surgical accuracy with customized sedation, the modern extraction resolves the biological issue while overriding the human panic response. Once the offending tooth is gone, your body has to manage a sudden biological void in the jaw. The initial 72 hours post-op dictate the trajectory of your recovery. The protocol requires total physical rest. To suppress the rush of blood and inflammation to the surgical site, you apply ice packs to the outside of the cheeks. Internally, your diet must shift to cool, soft textures. Smoothies, yogurt, and mashed potatoes provide calories without requiring the jaw muscles to work. Anything crunchy, hot, or heavily spiced risks severe irritation to the open wound. Maintaining this low-stress physical environment is the primary driver of recovery, providing the jaw the stability required for tissue repair. And that brings us to the most critical behavioral requirement of the entire recovery phase. Under absolutely no circumstances can you use a straw. If we look back at the cross-section of the newly emptied socket, you'll see why. Within hours of the surgery, a solid mass begins to form in the empty space. This blood clot is your body's natural bandage. It seals the gap, protecting the sensitive jawbone and nerve endings that are now exposed underneath. Sucking a liquid through a straw creates a negative pressure vacuum inside your mouth. That upward suction force is strong enough to violently rip the newly solidified clot straight out of the socket, leaving the underlying bone entirely undefended.
Surviving the removal of your wisdom teeth comes down to respecting the basic physics of the human body. You rely on the clinical experts and imaging tech to safely extract the tooth, you swap your straw for a spoon, and you let your biology do the rest.